Good evening, everyone, and welcome to our Bowel Cancer Update. My name is Helene. I'm the Workforce Development Officer here at Western Victoria PHN, and I'll be a facilitator for this evening. Alongside me is Catriona Pilbeam. She's also the Workforce Development, and she's the manager, actually. I'd like to begin by acknowledging the traditional owners and custodians of the unceded lands and waterways. I'm dialing in from Wadawurrung country today. We recognise their diversity, resilience, and the ongoing place the First Peoples hold in our communities. We pay our respects to those elders, both past and present, and commit to working together in the spirit of mutual understanding, respect, and reconciliation. We support self-determination for First Nations peoples and organisations. Just a little bit of housekeeping before we begin. You can view the majority of the webinar recordings freely on our PHN Learn YouTube channel. The link is up on the screen there at the moment. Please see our upcoming events on the screen now. You can register for our events via our website. We will put that link up there for you as well. Just a special mention to our annual Primary Care Conference. Registrations are now open. This year's conference is in Ballarat, and we have secured some fantastic presenters. We will put the link to chat in the chat for the conference page, where you can find more information on the program and also our incentive payments to support travelling to attend the 2-day event. So that's been our registration's been open for a couple of weeks now, and we've got really, really good attendances so far. So make sure you go in there and register for that event. Please make note of the West Vic PHN health pathways relating to this topic, and that is on the screen at the moment. Many of you will be familiar with Health Pathways, the free online resource and localised clinical and referral information for health practitioners. You'll see that on the slide here. If you have entered the webinar not displaying your accurate first and last name, could you just please type your full name into the chat box? Only the admin will be able to see this, and this is just to ensure that we get your certificate to you. For this evening webinar, all participants will remain on mute. If you have any questions, just type them in the question and answer box, and they will be addressed at the end of the webinar. Your feedback is important, so if you could take the time to complete the survey after the webinar, that would be appreciated. We'll put the link for that in the chat as well. Our presenters for this evening are Catriona Bastian, Bowel Screening Program Manager for Cancer Council Victoria, and Mr. John Lee, Head of Engagement and Communication, Telstra Health National Cancer Screening Register. I will now hand over to Catriona to start. Thank you.
Unmute myself and share the screen. Can everyone see that okay?
Yeah, that's great.
Excellent. All right. Well, thank you so much, Helene, for that introduction. It is lovely to be with you here tonight. So I am going to be discussing the National Bowel Cancer Screening Program and your role as healthcare providers in encouraging participation of patients into the National Bowel Cancer Screening Program. I'll also be covering the alternative access model, and then I will pass over to John, who is going to speak more about the National Cancer Screening Register, integrating the register with your clinical information systems and, accessing screening information. All right. So in Australia, we have one of the highest rates of bowel cancer in the world. And 1 in 14 Australians at some point in their lifetime will be diagnosed with bowel cancer. 93% of those people, though, will be over the age of 45. And bowel cancer is the second biggest cause of cancer death in Australia, and that's only behind lung cancer. So in its early stages, bowel cancer can sometimes have no symptoms, signs or symptoms. And this can often be one of the reasons that people delay screening because they're like, well, I don't have cancer because I don't have any symptoms. And that is one of the misconceptions that we need to help clarify with patients about screening and the purpose of screening, and screening when you are asymptomatic and have no symptoms. But some people may experience some of these signs and symptoms. So changes in bowel habits, diarrhea, constipation, smaller, more frequent bowel movements, changes in appearance of bowel movements, feeling full or bloated in the bowel or rectum, any abdominal pain or swelling, feeling that your bowel hasn't emptied after you have been to the toilet, any blood in your poo, in the toilet, or on toilet paper, unexplained weight loss, any weakness or fatigue, rectal or anal pain or any lumps, and also low red blood cell count or anemia, which is often also linked with that tiredness and weakness. Now, other medical conditions, some foods and medications can also cause some of these changes. But we are saying to people that if they notice any of these symptoms persisting for longer than 2 weeks, to go to their GP and get that, just get it looked at. I think it's also important just to note that these signs and symptoms can occur too at any age. I guess this is one of my big key messages for tonight, and that is that when detected early, more than 90% of bowel cancers can be successfully treated. And at the moment, though, only 50% of bowel cancers are being diagnosed early. This slide is really showing how early detection does save lives. So you can see here from this slide that the 5-year relative survival for bowel cancer is much better when you compare a stage 1 diagnosis with a stage 4 diagnosis. So 98% of people are alive 5 years after a stage 1 diagnosis versus 15% who are still alive 5 years after a stage 4 diagnosis. And participating, this is why we're encouraging people to be participating in the bowel screening program, doing the test every 2 years, because it's one of the most effective ways to detect the early signs of bowel cancer. So we have the National Bowel Cancer Screening Program. We use an IFOBT, or immunochemical fecal occult blood test. And this test is, as I said, part of the national. This is what we're using as part of the National Bowel Cancer Screening Program. The program is federally funded, and it commenced in 2006. And as part of this program, people aged 45 to 74 can do a free test at home every 2 years to detect bowel cancer before symptoms appear. So the test works by picking up blood in the stool or poo, by identifying the immunochemical properties of heme, which is a precursor to hemoglobin, which is necessary to bind oxygen in the bloodstream, by use of antibodies. It's only detecting blood from the colon or your large bowel, not your whole gastrointestinal tract. And it has an 85% sensitivity and is 93% specific for detecting bowel cancer. So it is a reliable and safe method. So from the 1st of July this year, the National Bowel Cancer Screening Program lowered its eligible screening age from 50 to 45. And this change was based on approved updates to the clinical practice guidelines for the prevention, early detection and management of colorectal cancer. So I think this is a really positive change to know that, our national screening program aligns with the latest evidence. So from the 1st of July, eligible people aged 45 to 49 can request their first bowel screening kit to be mailed to them by visiting the National Cancer Screening Register's website, and the link's there on the screen, or they can call the NCSR on the 1-800-627-701 number to order their first kit. Now, when they do that, they're also actually registering in the program. So that means that they will automatically be sent a kit every 2 years from the time that their last screening kit was completed and sent back. So they're kind of opting in, and then they're registered for the program, and they'll continue to get a kit every 2 years. Eligible people aged 50 to 74, they continue to receive their bowel screening kit in the mail every 2 years. So nothing changes for them. And we're also encouraging people of all ages to speak to their doctor if they've got any further questions about bowel screening. So I'm not sure if you've had a few questions over the last month or so from people coming in asking about the bowel screening or not. Just to recap, eligibility criteria for the National Bowel Cancer Screening Program. You're eligible to do a screening test every 2 years. If you're aged between 45 and 74, you have a Medicare card, and you are an Australian citizen, a permanent migrant, or you are a Department of Veteran Affairs customer. And you also need to have an Australian mailing address. So the NCSR uses the addresses that you have registered with your Medicare card. So whatever that address is, that's where your kit will be sent to. So it's important to make sure that that address is correct and up to date. So participation in our National Bowel Cancer Screening Program, in Victoria, it's currently 42.6%. And that was for the 2-year period from January 2021 to December 2022. So that's quite our recent data from the AIHW. It has dropped from last year, which was 43.9% participation rate. But modelling shows that if we're able to increase and maintain participation rate in the program at 60%, it's estimated that we could save around 84,000 lives by 2040. So that's the target, and that is what we are all working towards. So what are some of the things that you can be doing to increase bowel cancer screening within your clinic? Evidence shows that GPs and nurses are a very trusted source of information and a real key motivator to screening here in Australia. An Australian survey has shown that 90% of respondents would be more likely or very likely to complete bowel screening if it was recommended or discussed with them by their doctor or GP. So one of the most effective ways to increase bowel cancer screening with your patients is to be recommending the test to eligible patients. Now, whether that's conducting a full eligibility audit and sending out recalls and reminders, or if it's just having an opportunistic conversation with a patient when they come into your clinic, explain why the test is important and that it needs to be done every 2 years. A lot of people think that they do it once when they turn 50 and then that's it, that's their bowel screening done. They don't understand that it needs to be done every 2 years to make sure that, nothing's changed within that time. You can order demonstration kits from the National Bowel Cancer Screening Program's website. They also have a checklist for talking to your patients, if that's something that might be helpful for you. But we know that many people don't actually even open the envelope, let alone the actual test kit, to see what is inside the test kit and what's involved as part of the test. So if you're able to take the time to show patients what's involved and what's inside the test kit, that can be really helpful as well and demystifying the process. Another way, and another very good way of increasing participation in the National Bowel Cancer Screening Program, is to bulk order program screening test kits for your practice through the alternative access model. And these can then be offered to eligible patients during an appointment, and this can be done through the National Cancer Screening Register's healthcare provider portal. So, once you've spoken to your patients about screening, you can then offer them a kit that they can take home that day. This can also be really key in helping people decide to do the bowel screening test, and will help increase participation, especially in those lower screening groups. So we know that people who speak a language other than English, our Aboriginal and our Torres Strait Islander communities, and also the lower screening age group of people aged 50 to 54, they're our lowest participating age cohort in the program. So they're some of the people that we really need to support and encourage to participate. When using the alternative access to kit, it's really important to just make sure that the patient is eligible. So by logging into the NCSR, just to make sure that that patient hasn't screened somewhere else. Complete the alternative access model issue, reissue a kit form, and then print that out and give that form to the patient with the kit. And these steps will ensure that the samples will be tested and the results will be sent back to that the correct person. Now, I'm going to show a couple of videos now. This first one is how to bulk order kits for your practice, and then the next one is how to reissue a kit. So it kind of just it shows you a demonstration of what I've just been speaking about. All right, here goes.
So you've logged into the healthcare provider portal, and along the top is the button for IFOBT bulk orders. Click here to start your order. Before ordering kits for the first time, you must complete some short training to understand the alternative access to kits model and your role in it. Once you've done the training, the ordering process should only take a minute or two to complete. Click on Start Order. Because you've already logged into the portal as a healthcare provider, the IFOBT bulk order form will pre-populate several fields. You will, however, need to enter your clinic name and phone number. While the address of the clinic will pre-populate, a different delivery address can be entered. This address won't change the address held in Medicare. It will just be for this order. Next, you need to decide how many kits to order. They're ordered in batches of 10, with the recommended number per provider being no more than 30 kits. More can be ordered if you have a large eligible patient base, but the kits have an expiry of about 7 months, so keep this in mind when calculating how many kits you need. You will also be asked how many healthcare providers the request is for, how many kits you currently have in stock. If this is your first order or have run out, the answer here can be 0. And if you do have kits in stock, whether any are expiring within 4 weeks. Capturing this information will help minimize kit wastage and ensure kits are available as needed. Click Next. If you order 30 kits or less, you won't see this screen. If your order is for 40 or more kits, you will be asked for a reason. This helps us better understand how large orders of kits will be used. Options include awareness raising, promotional campaign, kit distribution in hospital, or another reason. Click Next. Lastly, you will see your order confirmation. If you have any changes, use the Go Back button. Check the acknowledgement and confirm you understand the requirements of kit storage and distribution, then submit your order. The next page confirms your order. The tracking number will be displayed on the IFOBT bulk order page within 10 business days. Only your most recent tracking number will be displayed in the portal.
All right.
So you've logged into the healthcare provider.
All right, so now you have ordered your kits, they've arrived, you've got them in your practice, and they're ready to be handing out to patients that have never screened before or of lapsed screeners. But you also need to figure out who these people are. So this will generally happen opportunistically during a consultation in your clinic. You may be out in community or you might be doing an audit, a bowel screening audit within your practice. But it's important to log into the NCSR healthcare provider portal and search for the participant to see that they are in fact eligible for the program. So if your system is integrated, you can also do this from the NCSR hub within your clinical information system. But once you've identified correctly that the person is eligible and they haven't screened, you can then issue the kit and submit the alternative access to kit form. So this video is now going to show us how to go through that process.
To get started, search for the participant. Click on the active link next to the Bowel tab. Under the form area, click on Choose a Form and select Alternative Access Model Issue Reissue Kit. Next, confirm and update where needed your patient's details, including address, nominated healthcare provider who will get a copy of the results, and where applicable, person's personal representative, Indigenous and country of origin details, if applicable, and your patient is happy to share this information. And self-care, mobility, and communication details. For example, if somebody needs help with a test or language translation. Click Continue. The next page asks you to select the reason for issuing the kit. The system identifies by postcode whether the participant lives in a region where the average monthly temperature is currently over 30 degrees Celsius. Samples need to be kept cool for as long as possible, as heat can impact the performance of the completed kits. It's recommended to offer the test kit to patients during cooler months, but this can be a judgment call by the issuing healthcare provider if they see a clinical benefit. If you select yes to proceeding, you'll be asked to provide the date you issued the kit and its expiry date found on the back of the kit, and confirmation that your patient has given consent to receive this kit. Next, review the form. If any details need to be changed, you can do this by clicking Edit. Once the details are correct, press Submit and print. Then wait while the participant details form is generated. This may take a few seconds. Then print the form. Give the printed participant details form to your patient and remind them to complete the dates the sample was taken. Sign the form and include it in the prepaid envelope where they send back their samples. Once you submit this form, an icon will display on the participant's bowel record. This shows healthcare providers access to this patient's record that this person's received a kit via the alternative access model with this screen round. If you need to update and reprint the form, click on Reprint Participant Details Form. See a timestamp added to show when the last alternative access model reissue kit form was submitted. For reprinting the form, check or update the details as needed. To assist with patient follow-up, go to the My Correspondence tab. Here you will see notifications showing the result has not been received or is inconclusive. You may need to scroll to the bottom to use the slider. Use filters to refine the search. This is a prompt for you to encourage your patient to return the completed test kit. This section also displays notifications when the patient is due to be issued a kit for their next screening round.
All right.
To get started.
So that is the process there of using the alternative access to kits model. I know that some GPs use pathology provider bowel screening kits, but that data is not captured in through the NCSR. So that's not part of that 42.6% participation rate. So if you are using a pathology provider, it isn't captured. And also, you're not going to be getting the reminders and recall and follow-up that the NCSR is able to provide to both you and also the patient. So, you know, they'll be receiving the kit every 2 years, but they'll also be getting follow-ups, you know, if they've tested positive in a bowel screening kit or if they haven't returned their kit and so forth. So, you know, those prompts are there as well. So, which is they're the reasons we do encourage you to be using the alternative access to kit model and the programs kits with your patients. Both the National Bowel Cancer Screening Program and the National Cancer Screening Register's websites have recently updated their bowel screening resources, supporting both participants in the program, but also health professionals who are registering and integrating with the NCSR. So I would encourage you to have a look. I've starred the links that I've referred to tonight in this presentation, so you can easily find them. And I will send this slide through to Catriona and Helene, so they can share that with you if you are interested in going and having a look at some of these resources for your work. Like including where to order the demonstration kit, the checklist, and also the videos that we're showing you tonight are all available on the NCSR YouTube playlist. So really my take-home messages tonight, before I do pass over to John, is to be encouraging you to be speaking with your patients who are aged 45 to 74 about bowel screening. Bulk order kits for your practice through the alternative access model, and integrate your clinical software with the NCSR register if you are using best practice medical director or Communicare, because that does enable you to see the NCSR, the register screening details within your patient record. But I know John's going to talk a little bit more about that. So I will now hand over to John, who will take you through the NCSR and accessing screening information. Thank you.
Thanks, Catriona. Thanks for a great update. And also thank you to Western Victoria and PHN for asking me to come and join Catriona today to give you a bit of an update on the National Cancer Screening Register as well. I hope you're all well and staying warm, just like me under my blanket right now. So I'm going to talk about the National Cancer Screening Register, which is essentially a digital platform developed to underpin the Australian Government's National Cervical Screening Programme and the National Bowel Cancer Screening Programme. And it's designed to support the end-to-end operations of the programmes to help achieve that shared goal that we all have, being the first country in the world to eliminate cervical cancer by 2035. And as Catriona mentioned, saving over 80,000 lives from bowel cancer by 2040 if we can increase the participation rate to 60%. So the purpose of creating the National Cancer Screening Register is essentially to build contemporary infrastructure that can connect to the broader health ecosystem, such as healthcare providers through the integrations with clinical software, integrations with the laboratory sector as well, and also to improve data completeness and create that one single record for each participant of the two programs. So what does the register actually do? So it's not simply just a repository of data like a cancer register or a clinical audit register. It manages all operations for the program. So we work with our mail house and the contracted pathologist, Sonic, for the bowel program. We send out around 1 million pieces of correspondence each month. That works out to be about 260,000 bowel test kits a month included in that 1 million. And access to Medicare data enables us to identify never screened participants and send out invitations and reminders. So once somebody has screened, we then receive the results electronically from the labs, and all data is ingested into a participant's record in the NCSR, and that's managed and overseen by our team of health information managers. Now, the rules engine is based on the clinical guidelines, and that essentially takes all of that data that we've received and applies the appropriate clinical pathway for each participant. which then triggers the next action in the register, whether that be to invite again routinely or follow up with yourselves, the healthcare provider, or with the participant themselves. And then you can see that recommended next action in the healthcare provider portal, which is within PRODA, or from within the NCSR hub if you've integrated your software with the NCSR. So let's talk a little bit about those ways to access patient screening data. And as Catriona touched on, we have secure online channels to access and submit screening data for your patients. So we have the healthcare provider portal, which you've just seen the video demonstration of. That's within PRODA. And we've got integrations with Best Practice, Medical Director, and Communicare. And the functionality within the portal or through the integrated software allows you to access a patient's bowel and cervical screening results and histories, submit program forms electronically, manage your patient's participation and update details. And it provides the ability to order an IFOBT kit for your patient. So this could be to order a replacement kit for someone that's misplaced their kit or their kit has expired. And as Catriona mentioned, as of July this year, people aged 45 to 50 can now opt into the program. I won't talk too much about the alternative access model because Catriona's done a really good job of explaining how you order those kits and how you submit the form within the healthcare provider portal or through the integrated software. But it is good to know that when you're in the portal or the integrated software in the NCSR hub, you'll be able to understand if somebody is eligible for a replacement kit or that initial kit and to provide it to them as per the alternative access model. And you'll know that because the form that Catriona mentioned will be available in their record. If that form's not there, it essentially means that they're not eligible for a kit provided through the alternative access model. Now, some of the other functionality within the online channels, a number of different actions that you can take. So you can defer screening reminders, and you may do that based on a patient's specific circumstances, potentially going overseas. Order a replacement participant details form as well. So if they've got their kit, but they've lost the form, that can be ordered through the integration or through the portal. You can fill in a GP assessment report informing the NCSR that you've referred someone who's had a positive program test kit result after they've screened. And also, it's worth mentioning for the cervical program, you can access the full cervical screening history for your patient. That's probably one of the most utilized pieces of functionality within the software. And you can notify the NCSR if a patient has had a total hysterectomy as well, if we haven't been informed already through an MBS item and the like. And essentially, all of this exists to improve access to data and expand the ways that you can interact with the National Cancer Screening Register and the screening programs. And the ultimate goal really is to improve visibility of a patient's screening status to hopefully prompt conversations in clinic and improve rates of opportunistic screening. Creating that prompt when you see it in the integration or in the portal to make sure people have the information they need to be able to make an informed choice. In terms of access and usage, we've got around 27,000 healthcare providers accessing registered data via the portal within PRODA. And we've got over 3,200 practices that have integrated their software with the NCSR. So let's talk a little bit more about that. So this slide that's on the screen right now, this is focused to those of you that are looking to integrate your clinical information system with the NCSR. So if you have Best Practice, Medical Director, or Communicare, and you haven't yet integrated. So there are a few steps to follow here. Some of you that have linked other government integrations may be familiar with this process already and have already registered your organisation within PRODA. And these steps are really important due to the nature of the highly sensitive data held within the NCSR, and shows that the data is only accessed by the right people. So the steps to complete the registration for the integration must be completed by the responsible officer within the practice. So it's usually the principal GP, and they can also delegate within PRODA to one of their colleagues within PRODA to complete the registration. Now, the responsible officer or the delegate must have the organisation's ABN and the HPIO details to be able to complete the registration. And if the practice hasn't been registered as an organisation on PRODA already, you complete this step first. We've got lots of user guides, video user guides on ncsr.gov.au and YouTube, as Catriona mentioned, which walks you through the whole process right from the beginning. If you've never registered your organisation on PRODA, take you through that step 2, right through to the end where you've got a successful registration. Now, on the next slide, we've got a video of that last step. So you've already registered your HPIO, which many of you will have done already. This is one of the steps to complete to register for the NCSR. Can you come up here? Thanks.
Sorry. Hang on, let me go back. I'll start this again. Sorry, guys, I was on mute, so you wouldn't have been able to hear it.
To register your organisation with the NCSR, go to the Services screen and click on the NCSR tile. Select the organisation you're acting on behalf of. If you're an existing healthcare provider portal user who has already linked your account, you can complete the process from the Manage Practice tab. For first-time users, select Register a Practice using a practice management system. Enter your healthcare provider identifier organisation or HPIO number, which should match the one used for your clinical software. If there is another HPIO number linked to your organisation in this field, we recommend getting in touch with the NCSR Contact Centre before continuing. Fill in your healthcare organisation details, including organisation name, ABN and address, practice type and software used, responsible officer's contact information, technical lead, and an alternative contact. Check the I represent the responsible officer box and click Continue. If you need to register multiple practices, please get in touch with the NCSR Contact Centre and one of our staff members will guide you through this process. Click Register, then read and accept the terms of use on the next page to complete your registration. Your registration is now complete. You can configure the integration as per your software provider's instructions. For more information, visit ncsr.gov.au/clinical software.
Thanks, Catriona. Because there are a few steps in there, we've got a number of support materials. As I mentioned, the videos on YouTube on ncsr.gov.au and some written user guides, quick start guides. But I think probably the most valuable is that link that we've got at the bottom there, and I'll share the link in the chat. So we've got around 3,300 practices that have successfully gone through this process and integrated. But it's not always easy for everyone to go through all of those steps. So we've got some experts within the team who are ready and willing and would like to hold your hand through that whole process if you're struggling with it. They've done this hundreds and hundreds of times, and they know all of the steps and all of the bits that can trip you up along the way, and they're really successful in getting people on board. So if you are struggling, or even if you've not even tried yet and you just want to have that little bit of assistance, please do use that link, book in some time with one of our experts, and they'll help you out throughout the whole process. And that's everything from me. So I will hand back over to the lovely team at Western Vic PHN.
Hi, everyone. Thank you both to the speakers for this evening. Have we got any questions from the audience, please? I don't have any here in front of me. So now should the opportunity, if you've got any questions, to just type them in either the question and answer box or the chat box, and we can get the speakers to discuss. A few minutes. Do the speakers want to say anything else while we're waiting?
No, I don't. John, have you got anything you'd like to say?
No, just a big thanks for having the two of us to come and talk to you all, and hopefully if you do have any questions that come through afterwards, then we can answer them offline.
There's one question here. If someone doesn't complete a kit for several years, does the registry keep sending it to them?
Yes, yeah, every 2 years.
Yep, every 2 years they'll continue to send it.
Until you're age 74. So that's the last time you will receive a kit. Yeah.
Great, thank you.
And another, go on, KP.
Oh, sorry, Helene. It just says, will integration come to ZMed?
We hope to integrate with all vendors' software. So we've been on a big journey in interoperability over the years. We've integrated with 32 labs, so we're receiving everything electronically from the labs, which is fantastic. That's over 99% of data coming through electronically and in near real time into a participant's record. And we've had the best practice. Best practice was the first integration in January 2021, and we've slowly added more integrations to the mix. And we've also integrated with some specialist software as well, and looking at hospital EMRs too, so that people working colposcopy and gastroenterology can access. So we've talked to a number of different vendors, and everyone's at different stages in terms of their journey, because of course vendors have got lots and lots of work on their backlogs as well. At any time legislation changes or there's regulatory requirements, they have to make changes, so they've got lots and lots of work to do. But we do hope to see all vendors come on board eventually, just not yet for ZMed.
Right. There's another few questions here. What do we do with our expired kits?
That's a good question. I haven't had that one before.
I'd need to get back to you on that one.
That's okay. We can take that one on notice.
Yeah.
And if you can provide it, we could send it out with the correspondence that goes out to participants. Is there a different time frame for the kits being sent if they have had a scope?
Yes, so if we know about a colonoscopy, so if they've gone private, we would get the MBS item number, and so all data that we ingest into a participant's record affects their pathway. So that data included, if we're aware of somebody having a colonoscopy, essentially skips around as per the clinical guidelines. So they will receive a kit at 4 years instead of 2 years.
Good to know. Another question here. Does clinic need to set up the reminder, or NCSR will send the reminder to the patient?
It would be good if we could do both. So we will send reminders as per the clinical guidelines. We send a reminder if we haven't received the result from Sonic, from the contracted pathologist. But if you have the capability to also add flags or reminders on your system, I think that would also be really worthwhile in helping increase participation.
Another question, does the patient still need IFOBT if they are on 5-yearly colonoscopy?
5-yearly. I'd need to check in with my more clinical colleagues on that one.
I don't know. They don't. If they're screening through a colonoscopy, they only need to do it every 5 years, but they don't need to do a FOBT in. They can if they want to, but they don't need to. Yeah.
Thank you.
No more questions at this stage? No. Could I take this opportunity to thank both the speakers? That was a fantastic presentation. Lots of great information there. So those, the audience, I'd get you to share that information with your fellow colleagues. And of course, it'll be on our YouTube channel as well. So thank you very much for the presentations this evening. And we will see you again. Thank you. Thanks, everyone.
Thanks, John. Thanks,
Thank
Catriona.
you.
Thanks, everyone.
Thank you.